Patty's one of my favorite patients. She is one active young lady. She injured herself doing jiu-jitsu a long time ago. She came in with some instability of her knee. So she had surgery, right?
Yes.
How are you doing today?
Mora. I'm fine. How are you?
Good, thank you. So Patty is being so kind and generous to allow me to share her story. This is the knee that's been operated on. That's your typical ACL incisions over here, but this is what I want to show you actually. This is actually very exciting. Here are her surgical pictures. There's my name, okay, and day of surgery. So when I went into the knee, I found this large loose body over here floating around, and when you see a loose body, you have to ask yourself, where did it come from? I figured that out soon after. So loose body floating around the knee, medial compartment of the knee, and there's actually a cartilage defect way back there, and that's most likely where it came, or maybe it came from this little area here, a little bit of wear and tear. Okay, so far, loose body, medial meniscus tear, little minor wear and tear, medial compartment, and then I go to the outer compartment, which is the lateral side. So let's just give you perspective. Medial compartment, loose body floating around there, little meniscus tear there. Now I'm on this side over here, and just so you know, she actually came in for an ACL tear. I haven't even talked about the ACL tear. Little old fissure from an old fracture, right? It was you had a fracture, little old plateau fracture, residual fissure. Not a big deal, smooth that out. And then I go over here to the lateral meniscus, the posterior horn lateral meniscus, and what do I find? A root tear. I talk about root tears all the time. I think people are getting sick of me talking about root tears.
No.
But look, there's a root tear. Non-diagnosed on MRI, identified the root tear, and then of course her ACL tear. The ACL should be over here. There's just a little leftover fibers. These are very tiny amounts of fibers. So then I proceed with ACL reconstruction and lateral meniscus root repair. Those are my tunnels that I'm creating right there. Back wall, femoral tunnel, looks beautiful. I use Stryker flexible reamer system. Once again, there's a nice femoral tunnel. And then what do? I tie that root tear with non-absorbable sutures, luggage tag with a couple of them, 2 of them. And there's a loose body that I pulled out of there. And then I do my ACL attachment, and I also fix the root tear through the same tunnel. It's a special technique. When it's not often that you actually have lateral meniscus root tear, but anyways, I pass the tunnels through the ACL tunnel, and then I tied them outside the knee. There's her new ACL. Look at that nice, robust ACL and a nice angle.
Yay.
It looks beautiful.
Yay for me.
Yay for you, girl. And that was it. So back to the knee, it's looking great. I just checked the Lockman anterior drawer, looks awesome. She has great extension, almost full extension, and she still needs to work a little bit on her flexion and a little bit of atrophy. So we're over 3 months out from surgery. Yeah, like 3 months and 2 weeks, and she's progressing nicely. No longer using cane or crutches, or crutches or brace. And how you doing overall?
I'm doing good. Thank you, Dr. Mora.
How's the experience so far?
Good. And I can feel like it feels so much better. I just got to do my physical therapy. You got to do physical
Where are you getting your therapy at?
Dr. Kessler.
Kessler Family Wellness, OC Fights Docs. We'll give them a shout out.
All of their
Thank you
staff
so
is great.
much. I appreciate, love you. Thank you for letting me do this. And I wish you the best of luck and look forward to seeing you on the mat.
Yes. Thank you.
Okay, bye-bye.